time when we still had the city and Rampada together before the separations. So the picture will be that broader. I'm also happy that I'll be speaking also on behalf of the regional DHOs, because we really did this work as a region and as teams. I think much of the success that we talk about and we pride in came up as a result of teamwork and commitment as teams in the region, but not individual effort. So yes, I'm glad you presented that we got the funds, that money we got as it came. And it was used as per the guidelines, and I have not had any issues with accountabilities. As you have seen. If you have not seen, please endeavor to get your hands onto those accountabilities. They have been clean and retired. Yeah, so in December 2019, that's when the COVID pandemic was announced in Uganda. And towards the end of December, around the 22nd, 23rd, I received a team from the ministry. And they came and told us, you people, this thing is here, it has reached you. It has reached Africa. If we don't prepare, it will catch us unaware. So DHOs, please sit down and come up with a budget. So I put together my team, and we talked about so many things, including all the committees that Dr. Valide highlighted: infection prevention and control, treatment, isolation setups, and how we are going to do all those things. That plan and budget for the district came to 419.7 million, and we submitted. When we submitted, for us, we thought, well, now once we get this money, everything will be perfect. The first amount of money we got, as per the budget we had submitted, was 125.6 million. And then we said, and then, no, don't worry, you start, do what you can do with that money. More money will come for as long as you submitted the what? A budget. Things will be better. So I went into the meetings, like Dr. Marije said, of planning and coordinating. And information came. At that time, we were just describing who could be the possible suspect for COVID-19. We had those symptoms. So we came from that picture to a point of mounting a COVID-19 response. And that response took the following strategies. Number one was for us to have a public health risk communication and community engagement plan. It is under that intervention that we had a district committees established, revamping the district task force. A district task force chaired by the RDC is supposed to be present. In many cases, it is silent and not active when there is no pandemic or when there is no epidemic. So you revamp it, reactivate it when an outbreak comes up or an issue comes up to do with public health, but it's supposed to be resident and there full time. So that time we revamped it, we oriented the task force, we set other committees, the technical committees now for infection prevention, treatment, testing, and all that. We set the similar committees at the sub-county level. At that level, the lower local government, the sub-county chairperson chairs that meeting, chairs that committee. So we had to train them, reorient them, and arm them with the information that they were supposed to pass on to the communities for prevention. That was the time when we now got the information to give the SOPs and how we are going to respond. 2, public health information, and then the lockdowns. When COVID came in and it was confirmed, the response was that minimize movements, minimize gatherings, and you're going to do them as per the guidelines. Also, we got SOPs and we needed to communicate. Now, these SOPs, through the committees that had been established at that level. 3, now we had to have the pandemic or epidemic control measures. Now, these measures included 1, testing, 2, treat, and then the 3rd one, control. Now, those are big tenets of public health management. You remember at some point, the only facility that we would test was in UVRI. And it was difficult for us to fill samples to UVRI from Mbarara, from Chiruhura, from Rampara. And then we had meetings with the ministry. And thankfully, thank God for the scientists of Uganda. Around the same time, our scientists were able now to innovatively come up with a rapid test for COVID-19. Now that was a breakthrough for us as Ugandans, but also Africans. Because once it was approved, and WHO came on very fast to okay it and approve it. At some point, testing for COVID-19 had become a business. I look at you, I see your tummy, I see your face, then I will ask you maybe 500,000 to get a test. Another skinny man comes, I look at them, I feel pity for them, you can pay 200. And it was irregular. I remember we had a meeting with the PS, and we said that now that we have this rapid test available, let us make sure that every district, every health center for government is able to test. And then we demystified that thing of testing for business. Health facilities were trained, testing teams and laboratory teams were established and trained, and now we are able to test for COVID-19 at a health center 3 level. My friends, that was a breakthrough. Because when we were able to test, we would now manage to confidently say this one is sick, this one is sick of another thing, but not COVID-19, and we would clearly now, we use the word triage in medicine. Would we clearly say this one has COVID? No, this one has pneumonia, this one has something else. At the facility level. And that brought back trust in our facilities. One on that COVID-19, ojendo muri ya government. I wish I could translate that into better language. Go back. Kakati nga tusobola okukebera COVID-19. Mugende mu malwaliro ga government ge gasobola. That was a vote of confidence. We tested, but we had to treat. But all the things that we do are informed by science. We could not overwhelm Dr. Badija and his team with every person who tested positive 19 for COVID-19. So we had now to triage, categorize these patients. There are those that are positive, yes, but they are stable. They will be treated at home. That's the concept of home-based care. So many people were treated at home. That means we had to train health workers who will manage these home-based care patients in their homes. You test you, we test you, we send you home, then we keep in touch. Uriota, are you improving? Any fever, come back. We did that. But in between there were those who had a fever. They are still able to breathe comfortably, but they are coughing, but they don't need oxygen because we were able even to test for the saturation thing he told you. And those ones were classified as moderate. COVID-19 positive, yes. Symptoms moderate, managed at health facility. That brought up the concept of holding centers. That yes, not everybody will go to ICU because the ICU will break down. But let us have holding centers at Health Center 4s. We established one at Wizabweda Health Center 4, And we had to convert an old Kijanjali, in quotes, when you know these things. We had to convert one of the old kitchen, very old kitchen, at Wizwera Center 4. We remodeled it, we broke down a few things, painted it, converted into a holding center. Dr. Warije, quickly, because I'd written a requisition from the PS that I needed cylinders, I needed beds, I needed all those things that are required in an emergency room. But I needed them very fast. Before the PS could respond, but they had given us an instruction that we can work with the regional referral hospital. So I went to him, said, I have this holding center, I don't have these things. Give me. And he graciously provided all those things. And our holding center became readily active and available. If you want to see pictures, please, Mbarara to Bizwera is only 30 minutes drive. Go there, look at it, and take pictures, because this is an accountability engagement. When COVID went, for us that was an add-on. We're going to use that as an emergency room, or casualty room, whatever you want to call it, because, or what? Because we are working at making Bizwera a general hospital. So we have begun like that, as out of this COVID-19. The last thing, when you test, you treat, but also now, remember, this is a pandemic. You have to have means of preventing it and controlling it. So we went into the next phase of prevention. We did all those things, the lockdowns, the SOPs, the whatevers, to control. But the lockdowns and the SOPs could not prevent COVID-19. That is why, from a scientific point of view, vaccination came on board. Vaccination, ladies and gentlemen, is the gold standard for disease prevention and control. And the president came off strongly. It is extremely expensive to get those vaccines. We are happy and lucky as a country that Uganda benefited from the COVAX facility. That yes, it was established to make sure that countries that cannot manufacture or get ready vaccines can get the vaccines through that facility, which we did. And so, we got vaccines as a country. And the first one, we first got AstraZeneca, we got Johnson & Johnson, Pfizer, Moderna, Sinovac, and there was a lot of, let me use the word noise, for lack of a better word. The community is saying this, they are those media scientists, who think they know everything, even without evidence. We embarked on COVID vaccinating Ugandans. And once we started vaccinating Ugandans, science does not lie. We quickly started seeing numbers of new infections steadily but slowly coming down. We have had 3 rounds. The first round of accelerated COVID-19 mass vaccination, Mbarara district, the Greater Mbarara, we had a coverage of 52%. With all the community engagement and sensitization, only 52% individuals came. Round 2, our coverage increased from 52 to 68%. Round 3, as we speak now, our coverage has leaped. Now I'm talking about individuals who have received at least two jabs of vaccination. I'm not including the ones who are supposed to get the booster dose. Our coverage for the district, not individual antigens, but the coverage for vaccination has now gone up to 88%. Meaning that 88% of our population in the Greater Mbarara have been vaccinated. But we still have the 22 or 18% who are not yet vaccinated. Huh? 12. Yeah, thank you. Who are not yet vaccinated. They have their reasons. But now I've seen, because of the 88% coverage, I think nationally we are at what, Dr. Badiji? Maybe 60. At least with the 60% national coverage, you can see that the numbers of COVID-19 have drastically gone down. Remember, it has not gone away. We are not seeing the bad forms of COVID-19 that we used to see in 2020. So vaccination has done the magic, and that is where we are at. Why did our response be good to that level? Number one, we had a clear strategy to communicate the risk. We had those meetings. The chairperson of our task force, Afande Mwesigye, he's a very wonderful man. He gave us an environment to operate and treat Ugandans. He gave us all the support we needed, including security. We could work at night, we could move at night, and he would be there. We would call him and he would come, then he would order when we are with him. You go do this, you go do the other. That cooperation and teamwork was very critical for our success. Number two, we had engagement from every aspect. The public, the business fraternity, the community members, the religious leaders, everybody responded in the affirmative because they had understood what was at stake. And we had also described, because we had planned, in our original plan, we had that risk communication strategy, including everybody. When we engaged them, they came on board and supported us, including giving us food. We established, 2020, we established an isolation center in Rentang. People would bring food for our people in the isolation center. Yes, there was money to buy posho and beans, but we had food, we had matoke. They would even bring ghee. That was support from the community. It was very important. There was political will, like I said. We had security. We had enforcement. It is difficult to contain and control public. Aba boda boda, bakane batoroka, babuza bipapura, babuza chi, osiba hawa na hawa, osiba haria. But we had enforcement teams to contain all of that. But also, with the support from the ministry, we quickly had health teams, now from the technical aspect, reoriented and oriented to be firm. If you remember very well, ladies and gentlemen, in Sierra Leone, health workers ran away. They abandoned the health units and they went into hiding. Our health workers were equipped with information, trained and encouraged to attend to people at all times. So that was a strength for us as technical persons, that anybody would go to these facilities and there would be a health worker to attend to them, a health worker to test them and to counsel. COVID-19 was a mild sort of infection. Somebody would be told now you have COVID-19 and you see them get devastated. But the process of counseling and telling them we are going to do our best and you will be fine was a plus for us. We did that. Then availability of resources. At the time when we needed test kits, at the time when we needed trainings for the lab persons, when we needed money to do the trainings, to procure things, that money was there. So for you people who are here, take our gratitude back to the parliament, to the power that be. The other day I was told that when I am speaking, I focus on the president. Yes, President Yoweri Museveni, as a person in him, committed strongly as a person to see that Ugandans are safe And now it is time for us to recognize that. Please, if you have access to him, tell him
2026.
we appreciate. No, I didn't say that.
You said it's
But
time to.
it's time for us to appreciate him. The last thing I want to say to talk about him is this. Health workers committed a lot of their time. Even lives, we lost many. In this pandemic, we lost 3 DHOs across the country. We lost 6 ADHOs in the country. We lost about 22 senior nurses in the country. And in his wisdom, he has I can end it there, you have understood. Like health workers. So, when this, we appreciate him. That one I say without fear or favor. Then local resource mobilization time. We worked with the people local people, radio stations. I don't know whether Radio West is presented here. Yes, Radio West, very good. Vision Radio, Radio Maria, Radio not in digital. Yes, Cruise FM. Cruise FM. We worked with all these people. They were giving us airtime, not airtime of midnight, but airtime where you are speaking and you are sure that people are listening to you. And then they would call in, Dr. Wajirangwe, and you would talk, and we were not paying them. So thank you very much, the media fraternity, for that contribution. It helped a lot. Joint planning, we did that joint planning. Moving forward, as I conclude, for our next, whatever pandemic it will be, now there is Ebola in Congo. It has been confirmed and just near here. For the next pandemic, for the next epidemic, we must be able to do one thing: secure a budget and censure the information for the media fraternity. Quote me on that. I can say it again. We must have a budget for the media fraternity, but also work with them, manager,
Yes, sir.
and work with you and your teams, all of you, to censure the information that you are giving to the community. What we have learned in this last pandemic, there was a lot of information flying around, uncensored. Censoring means we sit and we agree on what package of information we are going to give to the media people and how they are going to run it, so that it is representative. It is representing you as the media fraternity, but also representing us, the technical persons, and it is the right information. That would help us. This WhatsApp almost killed us. The minister demonstrated how the vaccine was. And you see, oh my God. It was very difficult for us to take it back. Media, we love you so much, but we want to work with you in a very organized fashion. I thank you very much. My time is limited, but I thank you very much. Next time for this engagement, please communicate early, but also give us guidance to make a perfect presentation. For example, now I'm just talking off cuff. It should have been a nicely organized PowerPoint presentation and with recommendation and with the time enough. I think that would help us for us to do the accountability perfectly well. I thank you very much.